Because my last video presentation was interrupted when I was talking about the non-bacterial causes of septic shock, so to continue what I finished with in my video presentation on the live stream, that I mentioned that the malaria or the severe form of falciparum malaria, because this is the usual type of malaria which can be associated with shock syndrome, that the severe malignant malaria or Plasmodium falciparum malaria can cause a shock, whether directly or indirectly. And usually this type of septic shock associated or a shock associated with malaria is characterized by peripheral vasodilatation and usually carries a poor prognosis, and like other types of shock can be complicated by multiple organ failure. That's why we call it multiple organ failure syndrome. It is a type, pathophysiologically, it is a type of systemic inflammatory response syndrome. That's SIRS, what we call the SIRS syndrome, the systemic inflammatory response syndrome. It is associated with widespread inflammatory processes in the different tissues and organs of the body, with resulting multiple organ failure, with resulting acute respiratory distress syndrome, with resulting even disseminated intravascular coagulopathy, that's DIC, consumption coagulopathy. All these are complications of severe septic shock, whether bacterial or non-bacterial. And among the non-bacterial, as I mentioned, are the, I already finished the viral causes and the fungal causes, and I was just talking about the parasitic causes, and to be more to the point, I was talking about the protozoa as a cause of parasitic sepsis, and septic shock can cause shock directly and indirectly. And I mentioned that the malaria can cause shock through different mechanisms, pathophysiologically, through a secondary bacterial infection, that's co-bacterial infection with the malaria. So we should always search for a bacterial cause even in patients with falciparum malaria. We should exclude bacterial cause as a cause of shock. Other causes of shock in the severe falciparum malaria are the severe vomiting associated with the algid malaria, gastrointestinal malaria, also the gastrointestinal bleeding, which can cause a form of hypovolemic hemorrhagic shock in patients with malaria, also in severe falciparum with gastrointestinal bleeding. Also, it can be due to rupture of the spleen in patients with huge splenomegaly in falciparum malaria, and this will cause, of course, internal bleeding. And it can be caused also by cardiac dysfunction through the effects of severe malaria on the heart. So it can be a cause also of it can cause even cardiogenic shock. So shock in malaria can be septic, can be hypovolemic, it can be also cardiogenic. So malaria can cause, and here I'm speaking about the falciparum malaria being the severest form of malaria, which we call it the malignant malaria, which can be complicated really in clinical practice with shock. The shock can be direct and indirect. The shock can be any shock, any type of shock can happen in the falciparum malaria, and not only the septic shock, as the type and the category of shock which we can see in patients with malaria. So malaria can cause septic shock by itself, and it can cause also shock through other mechanisms, as I mentioned, cardiogenic or hypovolemic or like that. So this is the pathogenesis of shock in malaria. Other causes of septic shock, parasites which can also cause septic shock and reported in the clinical literature, is the Clonorchis sinensis. The Clonorchis sinensis is a type of platyhelminthes, belongs to the genus of platyhelminthes, that is the trematodes, class Trematoda, and it is one of the, we call it sometimes the Chinese liver flock, to be differentiated from Fasciola gigantica and Fasciola hepatica, and the Fasciolopsis pusci, the Fasciologia gigantea and hepatica, they are liver flukes. Fasciolopsis pusci is an intestinal fluke, and is a respiratory fluke, and there is also intestinal flukes. These all belongs to the genus Platyhelminthes, and they are trematodes. Trematodes, some of them, especially the Clonarchus sinensis, there are reports of being associated sometimes with septic shock, and there is case reports of the Chinese liver flukes associated with sepsis and septic shock. So if we go to the literature, we will find some case reports about this association between helminthes, especially flukes, and septic shock. Also Strongyloidus stercoralis, and we know Strongyloidus stercoralis is a roundworm. Also there are case reports of being associated with septic shock. So Strongyloidus, although it can cause respiratory helminthic infections, and it is one of the causes of what we call the eosinophilic bronchopneumonias, they can be complicated by a sort of shock or sepsis and septic shock. So Strongyloidus stercoralis also is another parasite which can be complicated by septic shock. Also, this is the most common parasites which have, but there are also reports of, for example, association of Giardia as one of the protozoal infections with also septic shock. So the Giardias, the Filaria, the Strongyloides, the trematodes, they are all examples of parasites in addition to the malaria parasite, and we all know that the malaria parasite is sporozoa, and the sporozoa belong to the protozoa. So all of these are examples of parasites, whether protozoa or helminthic infections, which can be complicated by a non-bacterial septic shock. And they can contribute to the shock syndrome, whether directly or indirectly through a secondary bacterial infection, as I mentioned, on top of the parasitic cause. So this is the in short the non-bacterial causes of sepsis and septic shock syndrome. I mentioned the viruses. I mentioned the fungal infections, including the systemic candidiasis, and I mentioned the parasitic causes of and examples of the parasitic causes of non-bacterial septic shock. So whether the source is respiratory or gastrointestinal or genitourinary or skin or even the central nervous system infections, we should always look for a bacterial or non-bacterial cause, and we should focus on carrying on cultures of the blood, searching for and serology, searching for bacterial as the most common cause of septic shock, or non-bacterial as a less common cause of septic shock. Cultures should include all of these microorganisms, bacterial and non-bacterial, whether the cultures are done on the blood or on other body fluids or on the bone marrow even, or on the sputum, or but of course the most important which we focus on is the blood culture, because there is no septic shock without bacterial or non-bacterial or septic invasion of the blood, which will start the inflammatory cascade and the pathobiology of the septic shock as a distributive type of shock, as I mentioned before, and the most common cause of distributive shock, as I mentioned before in my previous live stream. Thank you so much, and in my next presentation I will talk about other rare categories of the shock syndrome and their clinical practice significance. Thank you so much, and be careful and have a great day ahead, and I wish to all of you a peaceful, safe life.